Osteoarthritis is one of the most debilitating diseases around the world, affecting 30 million people in the United States. Osteoarthritis causes joint space narrowing, loss of articular cartilage, and rubbing of bones, which leads to a significant amount of pain, discomfort, and immobility to sufferers. According to the NHS guidelines, the most common treatment for osteoarthritis is a joint replacement, also known as an arthroplasty. The surgeon will remove the affected joint and replace it with an artificial one, known as a prosthesis. Disadvantages of this current treatment include a large incision site, which will lead to a bigger scar and increased chance of infection, more blood loss, which increases the chance of intraoperative complications, and wear and tear of the artificial joint. Early stage is a mild form when there is only unicompartmental degradation, the medial, lateral, or patellofemoral compartment. Mid-stage osteoarthritis is when there is bicompartmental degradation, such as the medial compartment and the patellofemoral compartment. And then there's severe stage osteoarthritis, which is when there's tricompartmental damage of all three knee joint compartments. Here is an anterior view of the left knee, showing the stages of osteoarthritis. This is important when thinking about robotic surgery on the knee, and we'll find out why shortly. Robotic surgery or computer-assisted surgery involves partial interference or complete dependence on specially devised machines to carry out surgical procedures. We can consider this particular surgery as a partially assisted one, as it is not the robot performing the surgery from its own decision-making, but it is in fact the surgeon utilising the help of a robot. The Princess Grace Hospital was the first private hospital in the United Kingdom to make use of MAKOplasty for those in need of a partial knee replacement. In those suffering from tricompartmental osteoarthritis, a conventional total knee replacement may be the best treatment, as the MAKOplasty resurfacing technique is better suited for those with only one or two affected compartments, with the aim of preserving as much healthy tissue as possible. MAKOplasty is a minimally invasive procedure that uses innovative technology to restore knee function. MAKOplasty uses a robotic arm interactive orthopedic system, also known as RIO, or the tactile guidance system. This arm is a surgeon-controlled device giving more precision and accuracy to a standard knee replacement, such as avoiding delicate nerves, for example the peroneal nerve, which is vulnerable during a total knee replacement, causing post-surgical pathologies such as drop foot. It can do this via the combination of virtual 3D imaging with intelligent bone sculpting tools. First, X-rays will be used to look at 4 different views of the knee, as seen just here. The surgeon can then identify suitable candidates for the MAKOplasty system. In this 45-degree flex posterior-anterior weight-bearing view X-ray of the knee, we can see loss of medial joint space, which indicates towards osteoarthritis. Computed tomography or CT scan is a diagnostic tool that quickly projects X-rays at a patient and rotates it so it can generate cross-sectional images. Once many slices are collected, they can be digitally stacked by the machine's computer to form a 3D image. This allows for easier location of basic structures and abnormalities in the knee, such as bone spurs. These osteophytes can influence implant positioning decisions during surgery. Therefore, the CT scan is used preoperatively to plan highly precise implantation based on individual anatomical structures of the tibial, femoral, and trochlear surface. And once the plan is created and implant depth, sagittal, coronal, and transverse rotation are shown, the surgeon virtually optimizes the implant positions within 1 millimeter and 1 degree.
So the MAKO system uses a CT scan of the knee to create a computer-aided design model, which is a virtual 3-dimensional reconstruction of the knee. So the MAKO software uses this to determine the anatomy of the patient's knee joint.
Here is a mid-surgery photo highlighting and illustrating the anatomical structures of the knee. So, with all the preoperative planning in mind, once the surgery has commenced, infrared receptors will be placed into the tibia and femur. The surgeon will proceed to probe in order to surface map the knee interior. They will compare this recent mapping to the previous CT scan, and the MAKO system will provide a real-time 3D mapped image with visual and auditory feedback. The surgeon is able to move the knee into correct alignments by matching it to the MAKO image. Diseased tissue can be removed via the robotic arm and seen to be removed on a screen. The partial knee implant is then cemented into the knee with a size chosen from the preoperative plan, and this makes the system customized to every patient. The plan is optimized during surgery based on motion data, tracking information, cartilage surface mapping, and a gap analysis to restore each patient's individual proper tension and tracking patterns. In the first image, we can see a right leg anterior view X-ray showing the invasiveness of a traditional implant compared to the other two images showing an anterior view of left side knees, and as you can see, a much more minimally invasive procedure with a less unnecessary artificial implant.
So far we've done studies that have shown that the robotic procedure is associated with reduced pain, reduced painkillers, reduced need for painkillers after the procedure, improved range of movement and faster return to home than a conventional procedure. There's also been studies to show that the robotic procedure helps to put the implants in a better position than in a conventional procedure. In my opinion, that it will be used to perform other types of surgery, so it will eventually move to shoulder surgery and spine surgery because it helps to reduce technical errors from the surgeon. I think eventually it will make its way into trauma surgery and soft tissue surgery such as ACL reconstruction.